the first hurdle that we had for organizing this program was we didn't have a proper venue, because our auditorium 1 was busy with exams, university exams, and the only option we had was auditorium 2. Now auditorium 2 does not accommodate 450 students. So till today 9 AM my worry was, what do we do with that extra students who have who have no place to sit? That was the main objective of this orientation program. I hope you understand what I'm trying to say. Most of our preparation for classes or any other thing is so wonderfully broken by y'all every time, and y'all consistently have been doing it for the last 3 years. That was the main objective of this orientation program. Basically, I think this is the first time we are having an orientation program for the second years, final years, part 1, or the third year, part 1 and part 2. And many of you would have wondered, what orientation for us? We are completely oriented with the AJ rules and regulations. We can wake up in the morning at 8:45 AM and consistently for the entire year get the attendance for the 8 AM class. Right? That's the first thing. 8:45 is when you wake up from bed. Consistently for the entire year, I know of at least 80 to 90 students who have not been marked absent a single day, and their time of leaving the hostel was 8:45, if at all 8:45. There are many who have done even after that. Now I think this won't work long. It's time we stopped it. Now there are a number of factors why, other than that objective, main objective, why we wanted this orientation program. There is also a number of factors that need to be told to you all. Now I'm sure, I think the number that were supposed to be present here today was 450. We have only, I think, 280 seats here, out of which easily about 30 to 40 are. So not more than 250 people are here, basically. So 200 are absent today from the 3 batches, if I'm not wrong. Correct? And there's one who is just walking in. Now this is a problem. You know, I'm not saying that's his fault. He's being used to the AJ kind of rules. There's no problem in walking into any class, any time. I hope you're getting what I'm saying. Right or wrong? Okay, 8:45, first hour class, you got your attendance. 9 o'clock, you're supposed to be in clinics. Okay, the second years don't know about it, clinics yet. Where are the second years? I can't find. Oh, there are a few here, okay. How many of them are there? Can you just please stand up, second years? The rest of them are confident about the results, or what's the reason? This is hardly 50, I think. Okay, sit down, sit down. Okay, 50 of you now and the others who will be joining y'all soon will be trained by the other almost 200 who are there as to what time you need to go to the 8 o'clock class. You are not used to 8 o'clock yet. You will be beginning with 8 o'clock. So what time you need to go to 8 o'clock class and what time you need to go to clinics. So they will train you very shortly. So, and if you are what time you need able to understand what they are, how they have trained you, if you have understood it clearly, you will also go their way. Fine? Okay. So let me come to objective 2. Why we had this orientation program. The objective 2 is largely now focused on those people who are CBME part 3, CBME phase 3 part 1. How many of you are here? That is now going to the third year. Please stand up. Oh, this is even bad. Not even 50. Your batch was 133? Huh? 149. 149 were there in the second year. Oh, okay, that includes the old batch. Okay. Where the class reps also not here. Ah, another is here. Okay, sit down. Now, you all are the second reason why we have called this. For almost 25 days, my biggest trouble was checking my WhatsApp message. That's because almost every student had a problem with attendance, eligibility, and HODs targeting me for allowing or helping you all get into the eligibility criteria. I hope all of you remember the incidents that happened before the eligibility was given to your batch. Attendance, pathetic. Performance in examination, pathetic. I think if we had actually gone for it, not more than 70 would have written the examination this time, second year examination this time. They were eventually so frustrated that HOD of Pathology and Pharmacology just gave up. They just said, okay, we are giving everyone because we need to blame the entire batch. Neither do you all have attendance, neither do you all have eligibility. I think both these factors needs to be taken extremely seriously. I don't know who had advised you so badly that I don't know the final year, that's the part 2 with whether they were so bad, but the advice that was given to you was really, really bad. Assuming that you will all get eligibility and not having attendance and terrible performance in sessional exam, I think was taken too lightly by all of you. If ever these things are repeated, I can assure you, on the very first day, not a single student will get any such favorable returns from our side. That is an assurance that I will give you on the very first day. No attendance, no eligibility criteria. It is entirely up to you to get it. I hope that point is extremely clear to all of you. Right? Okay, that's factor, 2 important factors. Your attendance and eligibility factor. Something to do with timing. I think you all have taken it too lightly regarding time as well. Anytime you can walk into a class, anytime you can walk out of a class. You can attend a class 1 hour, then be absent for the rest of the day. Or you can attend 3-4 hours, then afternoon you feel like sleeping, you go back and sleep. Practicals not important. AdCom class, never important. SDL doesn't make sense at all. Integration, I don't know whether it was done or not, but whatever. These are all things which you have been thinking will and have no sense. The point I want to make very clear on day one is none of this will ever be tolerated ever again. Point understood? Your classes begin at 8 a.m. will go on till evening. Now, whether the afternoon session is a practical, a seminar or whatever, small group discussion or anything that is allotted in the timetable will have to be taken seriously, and every part of that timetable is important to complete. How do we rectify this whole concept of, I told you get up at 8:45 and every day you're marked present. Of course, the proxy concept, it's not as if the teachers don't know how many give proxy. They know very well, but they are too tired to rectify what you have to do with yourself. So because we spoke of AdCom at the very beginning, I hope you have understood about how you need to build your attitude. But you all have taken it lightly. So to circumvent that problem, the only way we are going to rectify this is having digital biometric attendance, and that will be implemented right away. And if you have plans of making some gel fingerprints and all those things, go to Google, find out how to do it, YouTube, right today itself, and prepare your fingerprints to whomever you want to give, and start with that procedure right now, because if ever there is shortage in attendance, you will not be allowed. Now I want, okay, we'll ask the people going to the final year. At 9 o'clock you finish, assuming your 8 o'clock class. What do you go to clinics and do? Who will explain this to me? Every time at 9 a.m. you were going to clinics, say Department of Medicine, Surgery postings. Anybody who would explain this in detail, so that others who are just joining for clinics also will know what you did and what they are supposed to do? Anybody? Abhi? Come here and tell. Mike? Come friend. So what is the schedule like? Once you go to clinics, what would you do in your major postings?
So by 9:15 we'll be in the hospital after the 9 o'clock class, and doctors will come, and then we'll join the rounds if it's the ward days, and if it is OPDs, we go and stand near the tables, and then we see what the doctors do and we learn. And after the rounds are done, they ask us to take cases, which we take, and then by 11:30 or 11:45 they'll take attendance and ask us to leave, and then we'll take the bus and come back for the 12 o'clock class.
Anybody has done anything else other than this? Any additions, deletions? Open for discussion. Anybody else has done anything other?
So during the rounds we'll have case discussion as well. One of us will present the case, and the doctors will teach us what questions will come.
Okay, one of you will present. How many such students, how many are there? Final year, how many are here? Okay, in the last 2 years now, how many of you have presented cases? Almost all. How frequently? Every posting once. Okay. All have followed that? Good, bad or ugly, everybody has followed that. OTs, how many of you have gone? All of you? That's all of you, or anybody who has not gone to an OT now in final year? No, okay. Anybody from the third year? Now going to the third year. Who has had 1 year of clinical postings? Which is that batch? Anybody who can represent that batch? No. Who's in that batch? Who's the class rep? Ninada? Have you all undergone that same kind of training, or has it been different? Theory classes. So you all have not taken cases. You have presented, all of you? All of you have presented cases as well?
Usually they assign or roll number wise, something like that. Most of us are present.
And of the second and third year, now how many have documented what you have done? When have you presented a case? Any cases that you have written in the record books? Yes or no? Have you documented it? No. None of the times. They are not supposed to document it. Any other departments where they have documented medicine, surgery? No. Record books are. They are supposed to document. And you don't have a single document when you are reaching final year as well. How many of you have the record book? Right question, right? How many of you have the record books? You don't have the record book. Ophthalmology, I know there are 6 people who don't have the record book. Correct? Those 6 people may not be here, so that's a different story. Now, okay, sit down, Mirana. The point I'm trying to get to is, the objective of this session is when I think Ryan and others will take exactly what you need to do in your clinical sessions. Fine? We'll be guiding you in a way in which it has to be done that way. Now, the whole objective of having an Indian medical graduate was trying to get into an aspect where, I don't know how many of you remember what's the definition of an Indian medical graduate? What's the role? Anybody remembers? My class only, that's why I'm sure that nobody remembers. I've taken it for all batches. If I'm You remember those C2, L2P, being a good clinician, a good communicator. Now, it sounds all very Greek and Latin. You have 5 important goals: being a good clinician, being a good communicator, you need to be a leader, good leader, you need to be a lifelong learner, and eventually a good professional. These are the 5 goals of becoming an Indian medical graduate. And in that whole process, I think it can be divided into 4 quadrants. How do you become? How do you learn? And in that 4 quadrants, it is 25% of what you need to learn will be taught to you by a teacher. 25% only. 25% is self-directed learning. May not be the STL classes that you have, but what I am trying to say is self-directed in the sense you go and learn. You need to understand what you have to learn. Clinical teaching also is the same way. You may not be taught everything. You have to go to the patient and learn from the patient. It is otherwise the patient will not come to you, or neither other teachers will come and tell, go look at this case. It's your duty to go and find out what's the case and find out how to learn yourself. So 25% teacher, 25% self-directed learning, The other 25% is very critical now. It is collaborative learning from your peers, from your friends, from your seniors, even sometimes from your juniors. This is something that is never ever understood seriously. If you are in a clinical posting, your first job is to make a good friend who is your PG, is your best friend there. Go and meet the PGs, find out how to learn to take cases, how a history taking is done, what are the things you need to find out. And this job is yours, not of the teacher. So that 25% of learning comes from that very important aspect of peer learning, collaborative learning. Talk to your friends, go with friends and see cases. Rather than you seeing a case alone, it's always good you go with your friends. This is only happening if you have that intention to learn. And that last 25% is simply what you learn in life, lifelong learner. It's the experiences that you come across. So to be a complete medical student, unless you divide your learning skills into 4 quadrants, you will impossibly be a good doctor. I hope you got the point. 25% of the learning only comes from the teacher. 25% is self-directed learning. 25% of it is collaborative learning with your peers, your friends, your PGs, your juniors also at times. There may be a very good junior who has taken the case really well and has really understood the depth. Nothing wrong in going and learning that case from your junior. It's only a learning experience. And then the final 25% of the quadrant is just as you go through the phase in life, you will understand how to become a good doctor. And that part of it, please remember, in clinical postings, don't go by the exact rules what you have been doing. Many of you are seen back in the campus by 10:20, 10:30, when your clinical postings are actually till about 12. So to again circumvent that problem, the digital biometric will have an in timing and an out timing, both in and out in clinical postings, because you go as and when you want, you come back as and when you want. We want to avoid this problem as well. Fine. Then there is something about eligibility. I think somebody else is speaking about it. Your way in which you all attend sessional exams is something that is really the only confidence that you all have that I appreciate is people who have got less than 30 in all 3 sessionals, in all the subjects, have the audacity to walk up to us when there is time for applying for the exam to say, I will pass in all subjects. I really appreciate your confidence, and there are so many of in that level. Not a single sessional they've got more than 50. Not a single subject they've got more than 50 in a single sessional, and then have the audacity to come and say, I will write all the subjects and I'm confident I will pass all the subjects. Time left for the examination, 25 days. How do you all do it? I seriously don't know. Because we were finding it so difficult to read one subject in 25 days. You all are managing to do all the subjects. And to surprise me even further, when the results are out, many of them would have passed as well. That's the biggest surprise that eventually, because I would confidently think, no, they are going to fail, but they are just confident, I was thinking. But results have proved us wrong many times. Now, whatever that may be, but that does not complete your learning process. So what rules you need to follow for eligibility criteria, that will be addressed to. And other area regarding general discipline, the way you dress, the way you are around in the campus all the time. I still see a lot of you with beards is an absolute no. If anybody is found with beards walking around in the campus, will not be acceptable from now on. We are going to begin with this concept of, like I have told you, I think in the first year almost all the batches have told, if ever you are planning to do that, you're doing good to the community by sponsoring a little for the cancer patients. So we are introducing the concept of fine, and that will go to the CanCure fund, which will help a lot of cancer patients. So if your intention is to help the cancer patients, go ahead with the beards. And another thing that with the discipline comes with your mobile phone. Like I told you beginning as well, many times I've told all the batches, I don't mind technology being used in medicine. Technology can be used during classes also, but that does not mean you're updating your Facebook, Instagram and all the other things during class. The point is, as and when it is told to use, you may use, but not as per your choice. WhatsApp messages sent to the groups are seen by 60-70% of the students during a class. I hope you are understanding what I am saying. Some staff members, many a times they are doing that intentionally now, staff members send messages to the group, class groups during class hours to find out how many are seeing the message. 60-70% of them would have seen the message during a class. Some other staff member is taking a class. So mobile phones, absolute no. In case you want to help cancer patients, you can please see the mobile phones. We have no problem. Other discipline factors also will be dealt with. Another factor I think that will be spoken about today is about ragging. You are now in the second year. I think many of you would have not been in a position to get introduced to the juniors during exams because you had your exams. So now don't try to introduce yourself or get introduced to any of them in a way that is not appropriate. I hope you're understanding what I'm trying to say. Don't try to know the juniors in a manner in which it is not allowed to. So anti-ragging committee and squad will speak about both of this, and regarding in detail timetable and other aspects will be spoken to in the later aspects of this orientation program. We will be beginning with regular classes probably only tomorrow. A few of the second year HODs also will want to address you. Again, regarding the same thing, performance in practical exam, pathetic again. Very difficult to make you all pass the examination. So that also will be addressed by a few HODs. So I hope you understood the concept, objective of this whole orientation program. So the entire day is about grilling you all, and eventually, of course, one interesting aspect I think, I don't know how much you all think, is what's there for electives. The final year students who are going for the final year will be introduced to electives. The reason why we have postponed electives to not right away is because again of the results. We are assuming a few percentage of students may fail your first attempt, so the supplementary exam will be in 4 to 6 weeks time, in which case the students who have failed may be busy with exams and may not enjoy electives as much as they should. So in order to give everyone the opportunity to understand electives and enjoy it very well, we have postponed it to the month of May, probably after the university exams, so that everybody is involved in that electives. The others, second year and third year people also can get an idea as to what are the elective topics and which area is your interest and which you can choose. So the method in how they're going to choose and how you can choose, it will all be explained later today. So hopefully I've covered everything. Okay, I don't want to take too long again and disturb the entire process. So I hope the concept is understood. No help additionally will be got from any of the people in the management for any deficiencies that you are having in your academic work. You have to do it yourself, document it, and all details will be spoken to. And as and whenever we meet batch wise, we are having more sessions like this to make sure everything is followed in place. And I think others will take it, but any suggestions or any feedbacks that you want to give regarding clinical postings, theory classes, practicals, any of you are open to tell regarding that? Any suggestions that you all have? Regarding any factor that you think it's not going well, which is going to help you academically. Nothing as of now. Think about it. Anything that you want to tell, even later today, you can just put in that feedbacks and give us that, so that we can see whether we can introduce those aspects as well. You got the point? Fine. Right. Thank you.
Thank you very much, sir. So it is that time of the year when we reflect back and we have to rekindle what is it that we have joined medical education for. The passion should be from within. No matter whoever tells here how many ever times, it has to come from within you. And we should find that answer, what for we joined this particular profession. So in this regard, may I now call upon Dr. Ryan to talk on about clinics as well as about professionalism. Over to you, Dr. Ryan.
Good morning, everyone. So I think Sir has given an extensive introduction, and from that you know that things are not going to be like how it was, like how it has been happening. Because when I don't know, Abhi told us about clinics, I was surprised which college clinics is he talking about. Coming at 9:15, presenting cases every day in the third year. I was a bit confused. So, talking about professionalism, now you all have finished your first year. So first year students are coming to the clinics for the first time. Second year students are coming to the third year. Third years are coming as final years. So the moment you come, you think that you are going to get a red carpet welcome. Everybody there in the ward will be standing, waiting for you all, saying that finally you people have come, we were waiting for you. Without you all, we couldn't manage. We don't know how each day was going on. That is the expectation. Usually those who come from first year, suddenly they come to clinics, they think that is what they are going to see. And then like in the shows, you think that you all will be taken to the operation theatre. Suddenly the operating surgeon will forget the step of the surgery and will say, "Doctor, can you help us out? I have forgotten," and then you will come and take over. So these are the expectations that you come with, and that is how you behave also. Yeah, I finished my first year, now I am going to take over. Reality is this: your theory classes continue, you will be coming to the wards, the patients will be there lying down. Most of them won't even look at you because they have never seen you till now. So they only associate with people whom they see often. So theory classes continue, ward work continues. How you are going to be introduced into this setup, and what are the things that you have to pay attention to from now on. Sir has already touched up on a few of them. So the first thing that Sir asked you was, what is Indian Medical Graduate Training Program all about? So according to this, it is about possessing the requisite knowledge, skills, attitudes, values, responsiveness, so that he or she may function appropriately and effectively as a physician of first contact of the community while being globally relevant. And this has 5 steps to it. So among these 5 steps, I am concentrating on the last one, that is the professionalism, to make a professional who is committed to excellence in ethical, responsive and is accountable to patients, community and profession. So what is the first step? The first step of professionalism is you dress appropriately. So you will be coming to the wards. It's so unfortunate to see people, students with uncombed hair. You don't even comb your hair. Both boys and girls. Please don't think it is only boys. Both boys and girls with secretions in the eyes or near the corner of the eyes, hardened. Honestly speaking, they come in the morning like that with beard, with aprons that have not been washed. I don't know, there is this concept that the aprons have to be washed only when that water has to become brown. When you dip the apron, the water should turn brown, only then that day you will decide to wash the apron. So you want to go and present cases. You said that you want to present cases every day. You think any patient will want to talk to you with stains on the apron, wondering what kind of doctor this is. Wearing slippers, sandals, flip-flops to clinics and college, to the classrooms, unacceptable. So for the girls, the rest of the attire, I think it will be better if Dr. Maria or Dr. Padmini advise about. But for boys, strictly, like sir said, groom yourself, comb your hair, wear a nice clean apron. It is not that, like I told you, it's not that, so many things I see. You clean the apron once a year, at the end of the year. Now I think you all will come with brand new white aprons. At the end of the year, you decide to clean it. So this is very important when you talk about professionalism. Second one is punctuality. So very nice video every year, batch videos are made and we all laugh at it. With genuine problems, coming to theory classes, you come 8 o'clock class or afternoon 12 o'clock class, you walk in as and when you want, 12:10, 12:15, 12:20. Reasons given is breakfast, I didn't have breakfast in the morning, I didn't have the snack between the clinics and the theory class where 12 o'clock, between 11 to 12 I have to have a snack. Because of that I came late. So coming to class on time is, I think, one of the basic things, the basic respect you can give your teacher who is coming on time. Remember, your teachers have their own work, whether it is clinical, paraclinical, all of them have so many other things to look to in an institution. It's not just your theory class that they have to worry about in this institution. And if they can come on time, the least respect that you can give is to come on time for class. Next is attending clinics. Attending clinics, unlike your theory class where your staff comes to your class and take classes, remember that clinics doesn't work that way. Every morning, like you said, there will be rounds and there will be case discussions. The first thing that comes to the mind of the staff or faculty that day is not that I have to take class or clinics for the UGs. The thought that is there in their mind is, we have to look after the patients. There might have been a patient with stroke who has been admitted the previous night who is critical. There might have been a patient who has been operated the previous night who is critical. So the first thing in the mind of all the faculty, the postgraduates, is to do rounds and look after those patients. So you attending clinics means not going and standing there in the corner and waiting for the staff to come. Most of you have this thing that I will sit in the demo room, the staff will come and take class. Clinics doesn't work that way. You have to come to the staff and say, yes, today we have come. Not at, the clinic starts at 9 o'clock, not coming at 10:30 and saying we have come today. Come the moment you report to the wards, 9 o'clock, 9:15. By 9:15 you have to be here. One more thing that's commonly we see is, we cannot reach at 9:30 or 9:45 because we want to have breakfast between 9 to 9:45. There is no breakfast slot between your theory class in the morning and clinics. You come to clinics and first thing that you do is report to whichever. You all will be divided. Nobody is just sent to the medicine ward or the surgery ward. All of you are divided into units. First thing that you do is go and find out who is the unit chief, then all the staff in the unit, what are the names of the PGs. So many times during end posting we ask what is the name of the staff in this unit, you don't know. What are the names of the staff who have taken clinics, we don't know. If you don't know, don't even bother to find out what is the name of the staff in a unit, then what will you bother about the things that the staff has to say. So go and report. The first thing that you do, 9:15, go and tell the staff or the PGs we have come. The PGs are always there. PGs are supposed to be there 24/7, 365 days in a year. So you go and ask them what cases are there in the ward, what cases do we take. Inform the staff that you have come. Then the moment you inform the staff that you have come, they know that you are there, and then they will tell you what to do next. So that is about clinics. Second one is interacting with patients. Often they are told go and take case. So usually around 6 to 7 from a batch are posted in a particular unit. So one among those 5 or 6 goes to the patient and takes care. What do the remaining 5 or 6 do? Tell me honestly, what do the remaining 5 or 6 do? 6 of you all are posted in Unit 1 of Medicine. That one student has gone to take the case. What do the remaining 5 or 6 do? Do you all go there to take the case? I want honest answer. I am not asking what you are expected to do. What do you all do? Come on. Be bold, be free. Tell what you used to do. We will change now things. From your place, no problem.
Yes, the mic.
Nobody wants to admit.
Please, we would like to know.
What you have been doing, forget. It's okay. Now we are going to change. One student is taking case. What are the remaining 5 or 6 doing?
Because they're there.
This is not theory question that you have to answer. Why?
Feedback is important. Remember, it's a two-way process.
They are passing the mic then. So I will tell what you will do. No problem. So one student is taking case. There are a lot of vacant beds in our wards. I will myself admit, whether it is medicine, surgery, OBG, pediatrics, lot of vacant beds are there. So you all go and sit on those beds. Take your mobile phones out. Do something. Some of you all will do something on the correct. At least now nod your head. You all take your mobile phones. You all sit and chat. You all laugh. It's fine. It is okay to sit and chat and laugh. But remember, the patients watch. Patients watch everything that you do. So first of all, these people come like vultures, according to them. 10 of them will come. They will see the case, and over that they sit in the corner there, sit with the phone. They'll make fun. Next day you want to go and take case, you think you will say that you will tell the patient, drop your pants, I want to see your hydrocele, that patient will allow you. You think the patient will be cooperative? Most of the time you come and tell the patient is not cooperative, we can't examine. Why is the patient not cooperative? Because the patient knows that you are not here to, you are not bothered about them, you are bothered about yourself. Today you have come to take a case, tomorrow you will not bother about them. Yesterday you were standing and chatting there. So what you can do to avoid this? Any suggestion? You are posted in Unit 1 of Medicine or Unit 5 of Surgery. What do you think you can do to change this? Any suggestions from your side? For yourself, not for me. Never thought of this, how I can, other than taking case, anything I can do in the ward there. So you are posted in Unit 5 in surgery, or Unit 2 in medicine, Unit 3 in OBG. You will be posted there for 4 weeks or 6 weeks. Your postings are either 4 weeks or 6 weeks. Every morning, go and talk to all the patients in the ward, irrespective of whether you are taking the case or not, irrespective of whether that is exam case or not. Just go and ask the patient, how are they? They will at least feel that this person is bothered. It doesn't matter, you don't bother about their treatment, you don't bother about anything else. Just go and ask in the morning, how are you today? For 4 weeks you will be there. For 4 weeks you go and ask that patient, how are they feeling? They will start feeling that this person, this student is bothered. They will, if it is an exam case and you have to take that case, after a week they will volunteer to give you information. I will assure you that. Rather than just coming there and asking them for one particular day and then never looking at their face again. Most of you don't even thank the patient after you have examined the patient. As if it is that patient. These days patients, it's not like earlier where it is assumed that general ward patients have to be cooperative. These days most of these patients are scheme patients. They don't agree unless they feel comfortable with you, and this is how you can make them feel comfortable with you from day one. Go and talk to all the patients. So that is about attending clinics. Behavior towards batchmates. Now this is another thing. In first year you would have realized you all start being very close friends, and then slowly you all, as the time goes by, you all form your own groups. Then you all start having your own fights. You all have your start having your own problems. Then your culturals come. During culturals you all have your own problems. So whatever it is, remember at the end of the day, now when you ask your present interns, whatever has you all think is a big problem now in your personal life, you may not like one boy, may not like another boy in the class. One boy likes a girl in a class, that is another issue which you are most bothered about, more than your studies. Girl is not bothered, the girl likes a boy, doesn't like a girl, and vice versa. So all these issues, remember these are small issues in life. You will go ahead in life, you will have much bigger problems 10 years from now when you look back at these problems. Now when you look at your 12th standard, doesn't it look so easy? You all broke your head so much. Without those 12th standard marks, you wouldn't have got a seat in a medical college. That time, that was the biggest problem in your life. Now when you look back, you think, oh, why did I break my head? This medicine is, one is you'll regret that you got good marks and then you took medicine. That is one thing. Second one is you'll think that these problems now are much bigger than those. 10 years from now, you think these problems are much smaller than those problems that you are having now. So see that you all are all cordial with your batchmates. Behavior towards your teachers. So like I said, first thing that you should do is whichever, whether you all are second year students here, whether it is from first year, second year, third year or final year, please make it a point to know the names of your faculty. All the faculty, there are senior residents in clinical sites, they are also faculty. They might be the junior most faculty, but they are faculty who will be taking classes for you. Make it a point to know the teachers. Basic things. Please wish the staff good morning, good afternoon, good evening. It is something that I think parents teach you from the time your kids to wish your relatives, wish your teachers. One thing I never do once you become interns, if you see me in the hospital, whenever I'm going to punch you, you'll see that I never look up. It is on purpose, I never look up at any faces. You know why? I look down and I walk, I punch and I go. Why? I started this habit after I joined this institution. Exactly 3 years ago I joined. In this month. I don't look up because initially my tendency is, by the time you become interns, I would have taught all of you. There is no doubt at some point, theory, class, clinics. So when you look up, you look at the student, you naturally expect the student to wish you. So many of the students wish. There are some students who just look the other way. So it becomes very awkward for me. Then there is one more group of students which does this. I don't know what I am supposed to do. Okay? Is that a way of wishing? And I don't know, you must be doing that to whom I'm walking like to person. And I'm not going to do that back. So I can't wish back because you have not wished me. I can't smile back. So I don't look, I just look down and I walk. If somebody wishes me, I look up and I wish. So these are the basic things in life. Forget being your teachers, anybody else you want to wish. When you all sit there on the beds, which are not supposed to sit in the wards, dean comes for rounds. HODs come for their unit rounds, unit chiefs come for rounds. Nobody even bothers to stand up, forget wishing, that is the least respect. They are passing by the bed and you are continuing to do your own things. These are all the basic things that you should do towards your teachers. And if you can't do that, then I don't know, there is something really wrong with the teacher probably or the system. So behavior towards teachers. And one more thing regarding behavior towards teachers, I want to stress one more thing. Just because one teacher teaches in a slightly stronger tone, when I mean stronger tone, maybe less friendly way, doesn't mean that teacher is bad. Compared to a teacher who teaches very nicely, very friendly, makes you laugh like this. Please don't have that impression. The teaching methodology may be different, but the information that is being tried to be given is the same. So never discriminate between a teacher based on what is the tone of teaching. Some might seriously teach you without cracking jokes, but they are teaching you. So everybody wants to teach, everybody wants you to do well. So don't discriminate based on that. No shortcuts in learning. And this starts right from the learning part. Forget about the exam, right from the learning part. I will study only the questions which have come 10 times in the last 10 years. Correct? You all just wrote exams and came. That is how most of you. I will read from Singhi. Singhi's most common questions, I am going to read that. Tomorrow when patient comes, you will say, no, this question I didn't study for the exam. I can't treat you. I don't know what is the diagnosis. So no shortcuts for learning. No shortcuts during exams. Remember, whatever shortcuts that you take, whether it is for learning or whether it is for the exam, we are all aware of it. Don't think that we are not aware of it. Sometimes we turn a blind eye. Sometimes we just think that, okay, if they are the ones who are going to do this and suffer, let them suffer. But in the end, it is up to you. You choose the right path right in the beginning. Now you are in the beginning of your second year, beginning of third year, beginning of final year. So this is the right time to choose the right textbooks, choose the right resources to study, make sure that you cover everything rather than just the important ones. Recognize and manage ethical and professional conflicts, not like Arjun Reddy going to the hostel to resolve conflicts like this. You will have conflicts. That is natural. You are going to have conflicts regarding your studies. You might have conflicts regarding your culturals. When you are working, when 150 students are together for 4 years, at some point or the other you are going to have conflicts. How you resolve conflicts is in a very disciplined way, not everything showing your muscles and showing the tone of your voice is not the solution. Remember, you all are doctors, you all are the ones who are going to be the examples for the future. So see that you are professional there as well. Behavior in the society. So most of you go with your aprons to, what is that cafe here, which all of you all go? Close to the college. Huh? You all post pictures, no, in that cafe here, very close to. See, you all are hesitating to tell that. Huh? TLC. What? TLC, yeah, no? Correct. You all go there with the apron. Correct? Wearing the apron. So the moment, remember, nowadays for us the big problem is that the moment you are here in the society, you are wearing an apron, eyes are on you. Remember that all the people around you have mobile phones. All of them, like, you go to any social media, and when I talk about social media, I'm talking about news sites like theIGworld.com, and see that there is something written about the doctor, something positive. Some doctor has done something positive. Well, the moment that something about doctors come, I go and read the comments. So for every one person who comments good, saying that, yeah, this doctor has done well, there will be 10 people saying, no, this is just for money, this is just for publicity. So doctors have become just like how earlier you used to talk about lawyers and police. All of them are the same. So same thing that they say now about doctors. So remember that whatever you do, they keep an eye on you. They might be taking videos, they might be so how you are going to behave there in the public, see that, especially when you are wearing that apron, that you all maintain the decorum of doctors. Again, clipping taken from your own seniors from their batch video. This is not actual ragging, this is from their batch video. All are my students. So I have taken their full consent to post this. Regarding ragging, I will say only one sentence because Dr. Pradeep will cover extensively about that. Ragging will be strictly punished. As you know or don't know, in the time period that you were answering the exams, your hostel committee has changed. Your ragging, anti-ragging committee has changed. And these committees will be looking into matters of ragging and anything else related to the hostel very, very, very seriously. I think I have had 1 or 2 meetings with your hostel reps as well, where we have discussed a few things. So ragging, anything is fine, but ragging will be taken very, very seriously. So I will not say anything more. Commitment to growth of medical profession as a whole. In the end, see that you are contributing something in AJ, Institute of Medical Sciences, both clinically as well as professionally. And last, I want to end with this. So you can see that this video went viral 1 month back. If you all are all on social media, you can see that that video went viral. That is of an IAS officer giving CPR to one of the government officials. And you can see that this clipping is from Times Now, and you can see that they have said that an IAS officer saves a government official. What they don't tell you is that government official is wide awake. CPR is given for only patients who don't have a pulse and who are unconscious. That CPR is being given on video, and every time you can see that whoever is giving the CPR is making sure that he is coming in the video. That CPR is being given on a chair. So rather than the heart, it is going like, I would be more bothered, more interested where that chair, which company that chair is from, because I would like to buy that chair. And the patient himself is telling him to stop. But the media says there that the government official has saved a person. But look at the images around it. What the doctors are facing. See that you don't have to suffer this fate one day. It's always, what to say, when somebody else is suffering, you don't realize. Don't ever be a part of this. So with that, I end this small talk on professionalism. I hope I was able to highlight some of the important points. There will be a lot more sessions that will be taken. Thank you.
Thank you so much, Dr. Ryan, on that very insightful and heart-touching talk. I'm sure all of you connected very well with that. May I now call upon Dr. Maria, Professor from Community Medicine, to talk about a very interesting module that has been coming out in CDME, which none of you have experienced so far, I believe. What might it be? Electives, yes. So she'll be talking on Block 1 electives. Over to you, ma'am.
Okay, thank you, Dr. Padmini. So I think, yeah, at least what I heard from when they wrote the third year exams, they were all very happy, we are going to have electives, and people are all very interested to go to the different departments and have some real, like how Ryan actually put up pictures of Grey's Anatomy and all those things. Maybe you have already decided that you're going for neurosurgery or decided all these things. Okay. So before we go to that, now, why are all of you here? At the end of 5 years, you want to become a doctor, right? Yes. So, has anybody already decided what I want to do as, like, now only MBBS is not enough, right? I don't think anybody is saying here that I'm going to go in for primary care practice or join a PHC is not your ultimate goal when you are here. So how many of you have already decided, yes, this is what I want in my life? Or this is what I'm going to choose? Anybody? At least somebody you would have chosen medical profession with some goal, or at least somebody? Anybody? There's no right or wrong. Okay, I don't want to call names. Nobody? Okay.
Probably a surgeon.
You want to take surgery. Okay, anybody else next to him?
Orthopedics.
Orthopedics. Okay, anybody else? Medicine. Okay, good. So what I see here is everybody knows, You say like, there are people who know that I want to do in this life. But there are many others who don't know, right? I don't know if you have not answered, but many will think that I will decide based on my next rank, right? I will see what is my rank and I will decide based on that which particular I will stick on to. Like you may say that I want a surgical branch, I want a medical branch, or many of you say that I want a branch which does not have night duties, which does not have calls. I want to have my share of life. Okay, so all these are the options which you have. Now for all of us, we never had an option to actually, see what are these specialities, how it works. Now you go to clinics, you see the people working for 3 hours and you are back. But you really do not know what is actually happening there. So all of us took seats without probably knowing what is happening in that department. Okay, for the first time in CBME curriculum, and I think you are the first batches who's going to get an option of electives. So what it gives you is, it gives you an opportunity to be there, work in the different departments, and to know what exactly is happening. So what happens is, you have your own dreams, and you have the way it has been shown in the media or in the different series which you see. Everything is not so glamorous, and everything is not that everything happens the way it is. So many of the people take it and then they realize I cannot cope with it, or things like that. Okay, so the first time it is giving you an option to know, and for many of us who do not know, actually I have not decided on any particular this will also help you to shape on, say, probably this is what I want to do, or maybe you never thought of this as a possibility after MBBS, but yes, you can do this also, you can get to know. So that is what is elective. So what is an elective? So it is a learning experience which is created within your curriculum, okay, before you complete your MBBS. So it is providing the learner an opportunity to explore, discover, experience the different streams of interest in the profession, okay. So you are going to have an opportunity to see all those things which are happening in the various streams which are there. Now, what are the objectives of having this electives? Okay, the CBME has brought this electives with, with the objective is to have a diverse learning experience, so that you can have the various different modules of electives which are going to be offered to you, so that you can have these various experiences. Also, you can probably do things like do research, stimulate inquiry, so that most of us, if you look at a child, it will ask you a why question so many times. Why is it? Why is that? How many of you ask why? You just want to finish reading this and you do not want to ask why. So why asking why becomes important? So you have medical innovations which are there, okay? You have a lot of things which are happening today, which are or innovations which are happening. Most of it sometimes are happening by MBBS or non-medical people. So you have an opportunity to go back to your basic sciences. Some of you you can go back to basic sciences for research. You can also work in various research projects which are there, and it also has lateral thinking. Okay, you may actually think about things which you have never thought that you can do past MBBS. So all these things is what electives is planning to give you. Now, as the name suggests, so electives is not something that you just, I will be and I will bunk. Okay, so please do not go with that attitude. I'm going to go home for the 1 month that I'm having electives. So this is not acceptable. I think sir has already re-emphasized about it. And electives will have assessment. Okay, so it will have formative assessments. That means you are going to be assessed as you are there in that particular different module. So you are assessed for your day-to-day work, how you participate. You may be given different activities which has to be done. All of this needs to be done. You also have to get a satisfactory criteria in your logbook by the preceptor or the one who is in charge of your module. Okay, so that is mandatory. And also 75% attendance is mandatory even in your electives. Okay, so this is important for you to give your final year exams. So otherwise you will not be allowed to give exams even if you are having attendance in your theory and clinicals. So before going to that, many of you spoke about, you have passion and you have passion for different things. Now what is passion? So you have somebody is passionate about different things, right? So passion is something that is not that something finds you, right? The passion is not going to come and tell that this is what I am looking for you and I want you to get this passion. So passion is something that you will find in your journey, okay? And to find passion, you should be prepared and you should be in accordance with that so you can find your passion. So you just cannot be lazy around and say that you're not having any passionate. So electives, if you do the electives properly, if you are taking it seriously, you attend, take on the module seriously, then probably it will able to kindle the passion in the particular areas that you want to do. Okay, and it will have a lasting impact for your career later on. So you can develop the passion for the subject, you can already strategize, decide on how you're going to go about, how you're going to have preparation for the subject that you want to choose. Okay, coming to this, so how is the structure of the electives? So basically you're going to have block 1 and block 2. So it has been put as 4 weeks, that was what was scheduled, but for the current batch which is going to take electives, it's going to be for 2 weeks. Okay, so it is 2 weeks postings. So you have electives block 1 which offers various subjects, block 2. The basic difference is block 1, the clinical posting will continue. Okay, so you will be going for your clinical postings in the session allotted, and after that you come back for your electives. Block 2 electives, you do not have your clinical postings, you are full time in that department which you have selected for the elective. So this is some of the electives which are offered or we plan to offer in block 1 in AJ. So you have genetics, you have molecular techniques, you have heart rails, ILC for cancer diagnosis, you have for blood bank, antibiotic stewardship, pharmacovigilance, basic research methodology. So these are the various electives which are being offered in block 1. Okay, so block 2, Dr. Ryan will continue on what are the different departments which I have given. So only thing what I want you to emphasize is, so please do not consider electives as something that is an option. Okay, so it is something which is being offered to you as a learning experience, and it is left to you whether you are going to use it in the right way so that it is beneficial to you. So you have various things which you probably have never seen in your entire thing, which till now you have not had opportunity to have an exposure to these various different sections of the medical profession. Thank you.
Thank you you, Dr. Maria. I now request Dr. Ryan to continue with the Block 2 electives.
So, like Dr. Maria said, electives means you get to choose from different branches, not whether you elect to attend or not. So, very important that 75% attendance concept. And now coming to the, this is not a lecture, I am just going to brush through what are all the electives that we have prepared for you all from the clinical side. Our Associate Dean Dr. Sushit was very particular that when we do electives from the clinical side, it should not be like a regular posting. What we are teaching you in surgery, what we are teaching you in medicine, that doesn't become electives. So we have gone through an extensive set of departments where you will be exposed to different aspects of medicine which probably right now you are not even aware of. So some of them are robotic surgery. So a few of you all will be posted in robotic surgery, and you will get exposed to that as well. Cardiothoracic surgery, endourology and transplant surgery, plastic reconstructive and aesthetic surgery, where again here not only flaps, reconstruction, cleft lip, cleft palate will be exposed to. Minimally invasive surgery, that is laparoscopy. Endoscopy and ERCP, that involves gastroscopy, colonoscopy, ERCP. Neurology, endocrinology, cardiology, neonatology, emergency medicine. Now there are two aspects, there are two things. One is emergency medicine, the other is critical care medicine. Emergency medicine is what happens in the casualty. Critical care medicine is what happens in the ICU. So they are two different things, and both are involved in electives. This is critical care medicine. Retina surgery, voice disorder, vertigo, audiology, de-addiction and counseling, that is from the Department of Psychiatry. Ethics, primary health care, interventional radiology, what are the procedures you know of varicose vein surgery. Can it be done without surgery? So interventional radiology, how using lasers, varicose veins and other diseases can be treated, embolization of tumors in the liver. Nuclear medicine, cosmetic gynecology, cosmetic dermatology. Cosmetic dermatology here, with the discussion with the staff, you will be having this exposure to facial rejuvenation, hair, PRP for hair, wart removal, tattoo removal, spine surgery, so exclusively just spine surgery, and followed by sports medicine and arthroscopy. Traumatonics, how to manage a case of trauma from triage to management. Radiation oncology, imaging in trauma, that is MRI, CT, ultrasound. In trauma, patient comes with liver laceration, immediately has to be taken up for surgery. So patient comes with splenic laceration. What are the imaging modalities that will be taken during these conditions? Also, we spoke about cardiology. There is a separate field now, pediatric cardiology and pediatric endocrinology. So these are the ones we have finalized from the clinical side. A few more may be added based on the discussion with few of the staff to make the experience as unique as possible, and I am sure that very few colleges will offer from the clinical side so much of exposure in terms of electives. So this is about electives from the clinical side. How do you choose which electives? Because everybody can't go to pediatric endocrinology, everybody can't go to minimally invasive surgery. How do you go? How do you choose? If all of you all want, 15 of you all want to go to cosmetic dermatology, all 15 can't go because there is a limit of 2 or 3. So, okay, we'll just ask now. I will ask you from the clinical side, out of my own interest, only the final years. Okay, only final years. How many of you all want to go for interventional radiology. Okay, there is 1, 2, 3, 4, 5, 6. Okay, many are there. Cosmetic dermatology. Oh, I expected a lot more, just one. Minimally robotic surgery. Okay, quite a few. Minimally invasive surgery. De-addiction and counseling. Nobody. So, how you are going to choose and how you will be allotted electives, that I will leave to Sushit sir and Dr. Maria. They will explain. But these are all from the clinical side. So, definitely something to look forward to. Which is why sir was so particular that we don't start with electives because of this attendance in the first month, and the whole point of having these electives is lost, which is why electives were pushed to later on. Thank you.
You are all, talking amongst yourself and deciding what electives you will be doing shortly. Yes, it is a little time away, at least it is quite near for the final years, but not for the second year yet. So on this note, I now call upon Dr. Reba, Professor and HOD of Department of Pathology, to address the second professional year students on the do's and don'ts in the Department of Pathology. Over to you, ma'am.
Good morning, everybody. Congratulations to a large number of you who just finished your examinations, the first professional, the second professional, the ones who are looking forward to having a good time in the second professional year, and the ones who are looking forward to the electives and exploring what AJ Institute has to offer in terms of the different specialities you can look at. So, at the beginning, let me directly address the second professional students, because that's what I am here for. You are welcome. We are a department of 9 faculty members and another 9 postgraduate students who are also your tutors. The lectures will be handled by the faculty members, so also the SGDs, that is the small group discussions. The introduction to the DOPE, that is the practicals, will be dealt with by the tutors, and following that we will be taking you to the practical classes where the staff will also be present. Now, a few things I want to emphasize to you is, first and foremost is the attendance. Please do not listen to advice from your seniors who tell you that you can come to pathology at any time. Oh, it's okay, you can come 5 minutes late, 10 minutes late, it doesn't matter. They will walk into the class, they will let you in. We do let you in, but the punishment is that you don't get your attendance, but you still have to stay through the class. You have to take down, listen to the 1 hour of class, and you go back without your attendance. Why we tell you that is because you require 80% attendance in all the 3 blocks to be eligible. Now the previous batches, that was your seniors batch, was given some leeway because they were the COVID batches so called, and they were permitted to attend. But for your batch, why we have called you for the orientation is that the attendance will no longer be condoned. you do require 80% attendance. And this 80% attendance is in your lectures, the DOE, as well as the SGDs. Okay. So now when I talk about DOE, SGD and the theory class, I want to make one aspect very clear, and the SDLs. The SGDs or the small group discussions are the topics which are very, very, very important for your examinations. Please note it very carefully. The topics we have selected in pathology for SGD mean that these are very important. Even if it doesn't come in this examination, you are going to be face that topic at some point in your clinical career. Whatever career you choose in your future, this is some topic which will be very important for you. So please do not miss the SGDs, and SGDs have to be attended very carefully. That is why it is called small group discussion, so that it is drilled and drilled and drilled into it, and you know it as well as your ABC. Okay, that is SGD. The self-directed learning on the SDLs are usually the 4 to 5 classes. There are 12 topics for SDLs, and these topics for the COVID batches, and because there was shortage of time, we were given 1 year and later it was shortened to just 8 months. So we could not take the SDLs. Now for your batch, we'll be taking the SDL regularly and properly. That is, the topics will be announced, the timetable will be announced well in advance in the notice board in front of the pathology department. You have to see what is that week's SDL. SDL is self-directed learning, and you have to come prepared for the topic beforehand, so that you will be asked questions on that and you will be evaluated, and this will be, the marks of the evaluation will be recorded in your logbook. So that's very important. You cannot come for an SDL unprepared. You have to come prepared for an SDL. And on the DOE, you have to listen to the introduction, see the slides, see the specimens, record it in your practical book, and before you leave the practical hall, you have to show what you have written. That is the answers to the questions in the practical record, as well as the diagram before you are eligible for attendance. So the 2 hours of DOE, to be eligible for attendance, you have to show the practical record. And when you come for practical classes, please remember to wear your aprons, carry your hematoxylin and eosin pencils, as well as the practical record books. Now one more thing I want to emphasize about the attendance is that many times you go out for sports, for intercollegiate meets, or for medical purposes, and later on you come and give a certificate and say that this is attendance. These you have to put in 80% attendance, and just because you have gone for a college sports meet which is sponsored by Rajiv Gandhi doesn't mean that you will be marked present in your record book. Please understand, this is a medical legal aspect. You cannot be in 2 places at the same time. So when you attend an intercollegiate meet, you cannot be present in the classroom. So you cannot present the alibi that you were present in the classroom when you attended an intercollegiate meet, or you might have gone elsewhere on medical leave. So you will definitely be marked absent in your record books, in your attendance record, but in the future, that is in the end of the year, when the attendance is being, this aspect is for all. When the attendance is being calculated, should you have a shortage of attendance, if this is an official leave which is granted by the college, this many days will be added to your percentage of attendance. Doesn't mean that you will be marked as present in your attendance record. Please note it very, very carefully. Whatever the kind of leave, whether it's a medical leave, whether it is a sports leave or intercollegiate festival, whatever, or even a medical. And for medical leave, it has to be submitted at the time. So these leave forms will be kept in the record in the college office, or there is a department office, and the attendance will be added. When these medical leave certificates cannot be given at the end of the year when you realize that you have shortage of attendance. When you realize that you have shortage of attendance, go run around here, there, pay some money and get some medical certificate from some quack, and then come, run it and give, and then say, I am eligible. That is no more accepted. All that is past history. This is the present. Okay, so that's about it. And I'll be directly talking to you when you come for the practical classes. So welcome to the second professional year. I hope you will enjoy your pathology classes, and this will be the basis of your clinical career, whatever you choose. There are electives in pathology also. We have well-defined modules where we will show you what exactly we do as pathologists, and I hope that many of you will take up a career in pathology after coming to the electives. Believe me, the electives are far more interesting than your regular dope. So welcome to pathology. Thank you.
Thank you so much, ma'am. For the do's and don'ts in pathology, like how sir has had this particular program for orientation, collaborative learning is a must, but learning only academics with your peers, not about how exactly to go about executing the do's and don'ts in a particular department. So the words are coming from the mouth of the Shankadinda Pandit Tirtha, that is what we tell, right? So please do follow whatever the guidelines are being put forth. May I now call upon Dr. Prajna Sharma, Associate Professor in the Department of Microbiology, to lay the do's and don'ts in the Department of Microbiology. Over to you, ma'am.
Thank you. So first of all, warm welcome to all the students who have come back after, I guess, 1 week or 10 days of vacation. So basically, I am here to address students who have given first year exams and welcome you all to the second phase or second year of MBBS. So in second year, you basically have 3 subjects: microbiology, pathology and pharmacology. Pathology, ma'am has already told. When it comes to microbiology, it will be in 3 blocks. In first block, we'll be basically covering general microbiology and immunology, and then the coming blocks, you'll be having the microorganisms will be covered in the respective systems, that is various systems. And then you have EdCom classes as well. 4 EdCom classes will be covered. And then when it comes to internal assessment, we calculated that the average of all the 3 sessionals. It's not the best of 2 or 3, it's the average of 3 sessionals. So if you don't write even a single sessionals, that will be considered as 0. So ma'am has already told, when it comes to any sports that you have to attend outside, we have decided that you have to take permission from the respective HODs before you go for any sports meet. Only when the permission is granted by all the 3 HODs of second years, then you can go ahead with your sports. Especially you can't go at the risk of bunking any of the sessional exams, because we will be considering all the 3 sessional exams, average of all the 3 sessions. Then while coming to attendance, it's, as ma'am said, 80% attendance is compulsory. If your seniors have told that at the end all the students will be given eligibility, no, that's not going to happen. Students with lack of attendance will be held back, and they can only go for the next supplementary exams and not for the regular exams with your batchmates. So that point we want to make it very clear to all. Rest, coming to medical certificate, ma'am has already told you, whatever for any medical reasons that you have taken long leave, that has to be submitted when you come back itself, not at the end of your term. And EdCom classes, we have 4 EdCom classes. The attendance for EdCom classes will be taken separate. That means you have to have 75% of eligibility even in EdCom classes. So you have, in our department, if you have 4 classes, you have to attend all the classes. If you have bunked 2 classes, you would have no eligibility to give exams. So EdCom classes are important as well. And then Dr. Maria has already told about the electives. We have 3 electives from the Department of Microbiology. So we hope to see some 3rd year students coming to our department in the month of May, I guess. And then classes, we have around 2 to 3 classes in a week.
So we expect you all to be punctual. Maximum 1 to 5 minutes late is accepted, but not after that. And we don't want students to be using any digital devices in the classrooms. If you're using iPad, please, you have to inform us before the class. iPad for study purposes, not for playing games, because some students do have this habit of writing notes or referring using iPad. And then we do have small group discussions, which may be taken in your practical classes. And when you come to your practical classes, we expect you to come with clean, neat aprons, properly tied hair, especially the girls and the boys. And we do have SGLs, okay? SGLs will be conducted either as seminars where you will be given topics to present, or we give it as assignments where all the students have to submit it. So it is better you maintain a separate book for SGLs where the small topics you have to write it in your assignments and submit. You will be given mentors, each student will be given a mentor. So you have to submit this SGLs and your record books duly signed by your respective mentors. At the end of each sessional examination, we will be calculating your attendance. So even if the attendance is less than 75% for your sessional exams, you will not be allowed to give even your sessional exams. So attendance will be calculated before every sessional exams. So that's all I guess from the Department of Microbiology. See you all soon. Thank you.
Thank you, ma'am. So now we shall have a short break. Now the time is 11:15. We'll all gather back here at 11:30 for the rest of the session. Please note, attendance will be taken after you gather back. Thank you.
No, I need